Have things improved in Lombardy?
No. Things are just as bad as last week. So every day we struggle to find enough beds for our patients, and the number of patients keeps increasing. We have treated in total in our ICUs 1,300 patients right now, and almost 1,000 of them are currently being treated in the ICU. So it's a continuous increase in the number of patients, but this was somewhat expected because clearly all those people are those who are developing the disease, and they were probably infected before the lockdown of the country started. So I don't know, the experts say that, epidemiologists say that we should expect the peak of the curve for, let's say, tomorrow or the day after. And then hopefully we should start to see at least a flattening of the curve, and then finally a decrease. But for the ICUs, I expect that if this happens, we will realize it not earlier than next week. So at least this week is expected to be very bad for us.
What makes Lombardy such a hot spot?
We've been the first region with a serious infection. I mean that probably the virus has been around for at least 1 month before the first cases was diagnosed. So during that period, we were not able probably to diagnose or recognize atypical pneumonia due to coronavirus. And so in that period, many people got infected. And then something happened, like it happened in Wuhan, something happening in Codogno. It was like a sort of super spread. And then the fire started from there. And our region has a very high density of population, many people coming and going, moving around and Milan is the center of this. And so the virus had quite a long time to spread, and probably many people, many infected people and asymptomatic people are around.
Everybody everywhere is learning about the virus and how to tackle it. I'm wondering, if you knew what you know now, would you have started in a different way?
Well, not really, because it was just a big surprise for us, and everything happened in like 1-2 days. So at the beginning, we tried to track every contact of the first patients, but this has been incredibly difficult because, again, for example, we did not find the patient 0, but we find only the patient 1, and meaning that there were a lot of probably asymptomatic positive patients around, and so maybe the only thing that could have been done differently would be to anticipate the lockdown of the region and then of the country. So possibly that's the only possible measure that could have been done differently.
Can you treat everybody equally, or do you have to decide ultimately whether someone lives and someone else dies?
This is a very important point. In our life as intensivists, not only during the coronavirus outbreak, but in our normal life, we always, have to make the decision whenever we are called to see a critical patient, whether that patient can benefit or not from invasive treatments, because our goal is to be proportionate in care. Okay, so people who are good candidates for intensive care should receive intensive care. People who are not a good candidate for intensive care because their chances of surviving or of returning to normal quality of life should not receive intensive care, independent on the number of free beds or not. So until now, I can say that by increasing our ICU beds capacity and by increasing the total capacity of the system, we have been able to grant an ICU bed and a ventilator to every patient who has been judged as a reasonable candidate for ICU. And I'm afraid that if it keeps going like this, we will get to the point where the number of beds will not be enough for the number of patients. And so in that case, we will have to prioritize those patients who with the highest chances of surviving. But until now, I can say that we have been able to treat every patient who deserved an ICU bed.
we in Britain are behind you in that our outbreak was after yours. Do you have anything you can tell us in Britain about what to expect?
I think that the other countries and other regions have a small advantage compared to us, which is that you know that the virus is around. So you had some time to realize it, and it will be probably easier for you to try to identify the first cases, because now clearly everyone who go to the hospital with fever, cough, and interstitial pneumonia is a suspect case. So you can diagnose the first cases, and you can track their contacts, and you can try to contain the spread of the disease in limited areas. So that's my hope for other countries, that they will be able to contain the spread of the disease and to avoid this explosion of patients which invested us in the last 3 weeks.
Do you actually see people recovering? And in which case, what sort of proportion of people are recovering?
Well, luckily enough, we see people recovering. We see people recovering also from the ICU. It's very early to say because, for example, for ICU patients, the mortality published in the Chinese population of patients undergoing invasive mechanical ventilation was about from 40 to 50%. And this percentage, the percentage of people who die, increases with age and sharply after the age of 65. What we are seeing now is that out of those 1,300 patients that we have treated in the ICU, the percentage of patients who died was about 13 to 14%, and the same percentage of patients have been discharged from the ICU. But again, it's a short period of observation, because you have to think that most of these patients stay in the ICU and stay on the ventilator for at least a couple of weeks. So it's very early to give an estimate of the mortality, which will certainly be higher than 13%. But we have seen almost 200 patients recovering from ICU. Every day, a lot of patients are discharged from the hospital. So now the problem is that the number of patients who go to the hospital is higher than the number of patients who are discharged. But clearly it's a disease that can recover.
Professor Grasselli, thank you very, very much for talking to us.